New South Wales residents are being ripped off. But so are kids in Western Sydney. We learned yesterday that they're missing out on swimming carnivals because schools can't get charter buses. There's an unprecedented shortage of drivers. This is what Dominic Perrottet should be talking about instead of cashless gaming technology that won't be fully implemented until after 2028. But there's no business case for it. But he's promised to pay pubs and clubs one-off grants of up to $50,000 more borrowed money to invest in new income streams. Money everywhere being thrown at people. When one pub owner said a $50,000 grant wouldn't be enough to fund a soundproof band room. How do you pay for this spiralling debt? Well, last Thursday, the Premier was asked if there were any plans to sell more assets, and he said, well, he wouldn't rule anything in or out. Privatising Sydney Water was raised. That was Thursday. On Friday, when the Treasurer, Keane, was asked whether Sydney Water would be privatised, he said no. Do they know? But on Monday, the money kept flowing. $130 million to put air conditioning in all Western Sydney public school classrooms. Money to burn, or so it appears. There's a brand new hospital at Maitland. $470 million, opened in January last year. Doctors say they have no choice but to deliver suboptimal care due to a lack of funding. The hospital, brand new, is in crisis. While Dominic Perrottet is boring people with cashless gaming cards with virtually no detail, just like Prime Minister Albanese is boring us with The Voice, the problems in the New South Wales electorate just mount up. The number of people walking out of New South Wales emergency departments without being treated has doubled in 12 months. Chronic staffing shortfalls. Today we learn senior nurses in public hospitals are resigning in droves, suffering trauma and burnout from overwhelming workloads, leaving younger, less experienced nurses at greater risk of abuse from frustrated patients. But Dominic Perrottet is now promising to boost the number of nurses and doctors and allied healthcare workers. Are we entitled to ask why he hasn't already done this? Aren't battlers entitled to ask what is being done, where it matters, while all this money is being thrown around trying to bribe voters? Between July and September last year, according to Bureau of Health Information, 60,000 people left emergency departments before receiving treatment, up 87% on the same period in 2021. Only 57% of emergency department patients were treated in under 4 hours. And as I just said, the state's newest public hospital in Maitland, which opened in January last year, had the most emergency department walkouts, 2,481 between July and September. Campbelltown Hospital walkouts were up 160%, 2,465. Fairfield Hospital walkouts up 147%. Northern Beaches Hospital up 139%. Port Macquarie Base Hospital up 191%. Are these acceptable waiting times for voters in New South Wales who are entitled to ask what is being done?